Coronavirus has been around for a long time. We know about it since 1930. And every once in a while, there is mutation in the virus that cause the virus to cause new diseases. So in the past, we had coronaviruses that affected the human, jump from the pigs or porks to the human swine virus. Also, there's the MERS coronavirus, which is animal virus started in the camels and jumped to the human. Now, this new virus, the COVID-19, is started in the bats and jumped to different animals, then from an animal to the human. Why it happened now? There is something called mutation, which has changed the code of the DNA, like RNA or DNA, depend on the virus. And the coronavirus is an RNA. So every time there's a change in the code, the virus may die completely because it cannot survive the new situation, or get stronger, or get like some characteristic that make them like attack human or attack different animals. So this new coronavirus, it was an animal virus, was because of the change of the code, was able to attach to some receptors in the human respiratory system and cause the infection. We don't know much about it. Why the mutation happened? A lot of time is the environment, ultraviolet radiation, heat, chemicals. We don't know. It just happened. It can happen in human also. We have mutation all the time. Cancer is a mutation. Your cells start producing cancer cells because there's a mutation in the DNA of human. Coronavirus did not change. It's still the same, still as aggressive as before. At the beginning, we did not know much about it, so a lot of people got infected before even we know about the virus. And we saw a lot of bad cases that require ICU admission with intubation and a lot of death in the early stages. At the present time, we'll see easier cases and bigger recovery. It's not because of the virus is less aggressive, it's because we know about the virus more and we're following the social distance, 6 feet or 2 meters apart. We put a face mask, we cover our mouth. If we're sick, we don't go to work. If we're sick, we don't visit other people. And if we know anybody's sick, we try to avoid them. A lot of patients that they're highly susceptible to infection, like diabetic patient, heart disease, emphysema, they try to avoid contact with other people. Therefore, we haven't seen any aggressive infection at the present time because of our awareness of the disease, not because the virus is weaker now. So don't relax. The virus is still around, and still you have to take cautious hand washing 20 seconds with soap, alcohol rubs, which has to be at least 60% and above, and wear a face mask in public areas, and try not to get too close to your family, hugging and kissing if not necessary. Coronavirus is a real threat to our society. And the only way to stop coronavirus is by stopping the spread. In general, there is no treatment for viruses. And we all know since the beginning of history that if you have somebody sick, you stay away from them. And hand wash and cleaning. There is no antibiotics that works on viruses, maybe 1 or 2. There's some are under investigation at the present time, but there's no perfect situation to treat coronavirus or any viruses. So in general, the only way we learn to prevent disease, spreading of disease, is to stay away from sick people. So the lockdown is very important at the present time to stop the spread of the virus. And because we don't know much about the virus, we have to do it to the extreme. I know it can hurt the economy, and it did hurt the economy, but at the present time, that's the only solution until we have a vaccine or we have antibodies that can stop the infection. Is it true or a lie? No, it is true. The infection is there, and I've seen a lot of cases. I was in charge of the step-down ICU at Troy Beaumont Hospital. I've seen almost every day between 16 and 20 patients per day with positive coronavirus. I've seen a lot of death, young people, old people. It's scary. I've seen patients that they're doing well for the first 7 days and ready to recover and transfer out of the intensive care unit, and suddenly they crashed. Within few hours, they died. So the threat is there. If you worry about the economy, yes, it can hurt the economy big time. The problem is there is no solution at the present time. Should we open the economy at the present time? I think we should slowly and wisely. The government can give you the guidance, but you have to be the one who is in charge. You have to follow social distancing, keep 6 feet apart. You have to use masks. I know a lot of people are angry about it. They want to go outside without mask. I still say outdoor is okay as far as you keep distance with people. Don't socialize within 6 feet, and no hugging or kissing. Hand washing all the time. Use alcohol rubs 60% and above. But I think the government is doing the best to protect our citizens, and our job now to protect the society. So if you want to open the economy, go ahead and do it, but do it wisely. You have to follow CDC guidelines, OSHA guidelines. Personally, I'm a physician. I work with the coronaviruses, and I've seen the bad outcome of the corona. I'm a primary physician internist, and I see patients in the office. For the last 2 months, I was not able to because of the social distancing. Now we're going to open slowly. We're going to follow the OSHA guidelines and CDC guidelines by keeping 6 feet apart between patients. We don't have anybody waiting in the waiting room. And we're going to use the PPE all the time with our staff. And we will ask the staff if they want to work or not. We're going to ask the patient if they want to come or not. So we're going to open slowly but wisely. And same thing with every business, should open slowly and wisely. And I don't think the government is doing a bad job, is doing great jobs, and will give us the chance to take care of our life.